Have you ever had a toothache so painful you were convinced you needed a root canal, only to find out your tooth was perfectly healthy? What if I told you that your tooth problem might actually be coming from your sinuses? It sounds strange, it feels confusing, but it happens more often than you think. Today, we're uncovering the surprising connection between sinus infections and tooth pain, and how to tell the difference before you panic book a dental appointment. Stay with me, because this could save you money, stress, and unnecessary dental work. Here's what most people don't realize. Your upper back teeth, especially your molars, sit extremely close to your maxillary sinuses. The maxillary sinuses are hollow, air-filled spaces located right above your upper jaw. When they become inflamed or infected, a condition known as sinusitis, pressure builds up inside them. And that pressure, it pushes downward, right onto the roots of your upper teeth. According to experts at the Mayo Clinic, inflammation in the maxillary sinuses can create facial pressure that radiates into the upper jaw, mimicking serious dental pain. So the pain feels dental, but the cause is sinus. And that's where the confusion begins. Let me tell you about Maria. Maria was a 34-year-old teacher who developed persistent pain in her upper molars. She visited her dentist. No cavities, no cracks, no infection. But the pain kept getting worse. It wasn't until she saw an ENT specialist that she got the real answer: chronic sinusitis. After nasal irrigation and decongestants, her toothache disappeared completely. The tooth was never the problem. The sinus was. And she's not alone. Millions of people mistake sinus pressure for dental decay every year. How to tell the difference? Now here's the part you really need to pay attention to. How do you know if your tooth pain is sinus-related or actually a cavity? Here's what to watch for. If it's sinus-related, the pain usually affects multiple upper teeth, not just one. It gets worse when you bend forward or lie down. You also feel congestion, facial pressure, or a stuffy nose. The pain improves when your sinus is clear. But if it's a cavity, the pain is usually sharp and isolated to one specific tooth. It worsens when you eat something hot, cold, or sweet. You may notice visible decay or gum sensitivity. It doesn't improve just because your nose clears up. Here's a powerful clue. If your toothache changes depending on your sinus congestion, it's probably not your tooth. The Centers for Disease Control and Prevention reports that about 90% of adult sinus infections are caused by viruses, not bacteria. That means most cases don't even require antibiotics. They just need time and proper sinus care. You might be wondering, why does sinus pain feel exactly like a dental emergency? Because the nerves that supply your upper teeth run very close to the sinus floor. When inflammation spreads, those nerves get irritated. Your brain doesn't always know the difference between sinus pressure and tooth damage. So it sends one clear message: pain, and sometimes intense pain. That's why people end up treating the wrong problem first. How to relieve sinus tooth pain. If you suspect your tooth pain is sinus-related, here's what can help. Use a saline spray or neti pot to flush out mucus. Apply a warm compress to your cheeks to reduce pressure. Stay hydrated to thin out congestion. Try steam inhalation to open your nasal passages. Sleep with your head slightly elevated to prevent pressure buildup overnight. When the sinus pressure decreases, the tooth pain usually fades with it. But if symptoms last longer than 10 days, worsen significantly, or come with high fever or facial swelling, see a doctor immediately.
So yes, a sinus infection can absolutely cause tooth pain. And knowing the difference could save you from unnecessary dental procedures. If this video helped you understand your symptoms better, share it with someone who might be silently suffering from a mystery toothache. And before you assume it's a cavity, ask yourself, is it really my tooth or is it my sinuses? I'll see you in the next video.